Hi, I'm Shaker.
And I am Sukish. And this is Medicine
Medicine
Made
made
Simple.
simple.
In this video, we are going to be answering all of your questions about the COVID-19 vaccine.
But don't just take it from us. Take this information from Dr. Norman, the Secretary of the Kansas Department of Health.
Today, we are joined by Dr. Lee Norman, Secretary of the Kansas Department of Health and Environment. Dr. Norman received his medical degree from the University of Minnesota, did his residency in family medicine in Texas, and his aerospace medicine training in the United States Air Force at Brooks Air Force Base in San Antonio. After serving in the U.S. Air Force as a family physician, flight surgeon, and combat medicine instructor, he practiced medicine in Seattle for 20 years, also serving as the clinical associate professor at the University of Washington School of Medicine.
Dr. Norman has served as a chief medical officer for over 26 years. He is currently the clinical assistant professor at the University of Kansas School of Medicine. So without further ado, let's get this COVID-19 Vaccine Townhall started. Dr. Norman, thank you so much for joining us today.
Thank you very much. I appreciate being here. Thank you for the invitation.
So in your opinion, why is it important for people to get vaccinated?
Well, it's becoming abundantly clear, and that's a really good question, by the way, that the people who are vaccinated almost never get the illness. And those people who are vaccinated that get the illness, they typically do not require hospitalization. They typically have, therefore, a very, very low incidence of death. So right now we're seeing about 99.2% of hospitalizations, for example, are in unvaccinated people. It's a very safe vaccine and very, very effective.
Well, that's great to hear. So the next question is, do we need a third dose of the COVID-19 vaccine?
Yeah, so it'd be a third dose for the 2 vaccine series or a second dose for the 1 vaccine, Johnson & Johnson. The answer is maybe or even probably. The final research isn't in on that yet because we keep going farther and farther after the initial series, and the immunity tends to stay pretty intact. But I think it's highly likely that a booster dose will be required at some point. The FDA and CDC are not recommending that yet. The one exception I think that we're seeing now is that those people who don't have a very strong immune system, like organ transplant patients because the medicines are on and the like, they're probably going to get a booster dose even before it's recommended by the CDC or the FDA. And partly that's because the vaccine is so very, very safe.
Well,
we'll get back to you on that. We'll get back to you on that.
Okay.
In other words, on the booster.
Well, thank you for that answer. And on a follow-up question, one of the viewers asked, can we mix and match for this third dose or even the second booster dose? As in, if I got the Pfizer shot for my first dose, can I get the Moderna shot for the second dose or vice versa?
Yep, another great question. And the answer is not yet. And the reason is they're not approved for that yet. I think it'll be highly likely. I think more likely than mixing and matching Pfizer and Moderna will be matching, because they're both mRNA vaccines. More than likely it would be mixing and matching the Johnson & Johnson or a future non-mRNA vaccine with either the Pfizer or the Moderna, or a Pfizer or Moderna with the Johnson & Johnson, because that way there's slightly different receptors on the virus that are being targeted. It would probably strengthen the immunity to mix and match. It's not approved yet. We'll get back to you on that.
Okay, awesome.
All right, so speaking of getting vaccines approved, when will kids aged 6 or so be able to get the vaccine?
We had hoped that they would be there be approved by the time school starts. Of course, here in the Midwest, we start fairly early in August. There's not going to be an approved vaccine for under 12-year-olds for a while yet. We're hoping, though, before the fall and winter season comes to have it by then. We'll have to get back to you on that. That's the third time I've said that so far. But I think it will be even down as low as 6 months at some point in time. There's not one approved yet, but I think it will be hopefully before the fall and winter comes.
Awesome, thank you so much. So the next question is about the Delta variant of the virus. And the first question is, what is the Delta variant and how is it different from the other strands of COVID-19?
Yeah, it's the Delta variant. They all have a numbering sequence by the CDC, and you probably have seen those various numbers published. I think the CDC wisely tried to get a hold of the nomenclature, the naming convention, and because people were getting them wrong. The Delta the Delta variant is just simply another slightly different genetic strain that when we do whole genomic sequencing, let me explain that. Medicine made simple. Whole genomic sequencing means we run it through an analyzer that tells us exactly, and think of it kind of like what the DNA code looks like. It's very specific, and it's more infectious, and maybe it was a bit more severe. But the thing that has us scrambling now to keep ahead of it is probably around 60% more infectious than the other strains out there. It's making up a dominant strain in the Midwest now. It's probably as high as 80% of the COVID-19 viral strains that are isolated are the Delta strain right now.
So there's two follow-up questions with that. The first one is, why is it attacking the younger people more seriously?
Because the younger people are not immunized as much. It's younger people's immune system is more robust than older people or people with underlying medical conditions. This is purely and simply the fact that young people are not getting vaccinated. And of course, with all due respect for the two of you who are young people, a lot of younger people don't think that they're going to get it. They think they're immune somehow to it, or it can't affect me. And that's a logic that is getting a lot of people in trouble, a lot of people very sick and spreading it. Even if they don't get it themselves or don't become ill with it, they're very adept at spreading it. So I really appreciate what you guys are doing as it relates to getting the word out to younger people. Get vaccinated. It's important for you. It's important for everybody around you.
Yeah, well, we appreciate that, Dr. Norman. And then the second follow-up question with that question is, do you think that the Delta variant may cause another outbreak of the virus in Kansas, or even cause it to get out of hand again within Kansas?
You know, ever the optimist, I think it's not going to get out of hand, but we are definitely, as a matter of fact, we're in an outbreak of it right now. We have some of these rural counties, particularly in the southeast part of the state, a little bit up in the northeast part of the state, where the case counter is going up rather dramatically. It's not been as bad as our neighbors to the east, that is Missouri, but we are definitely going to see an uptick in cases from the Delta strain. So we are doing everything we can to encourage immunization and testing. It's important to remember, we must test, and we're also doing the whole genomic sequencing, the genetic typing on all of the positive isolates that we get now, because we really, it's like we're being a detective, tracking it down.
Yeah, that definitely makes some sense. Thank you. So you mentioned that it's really important for people of the younger generation to get vaccinated, but probably what everyone is wondering right now is, how effective are the vaccines against the Delta variant?
Very much so effective. It's not perfect. No vaccine is perfect. By the way, these vaccines are about as perfect as any vaccine in any recent memory. That's a spectacularly successful vaccine and vaccine campaign. But they're, they say 95% on the protecting against getting the illness. Even like in an influenza year with an influenza vaccine is oftentimes only 70% effective. And it's fascinating. Polio has been essentially eradicated with vaccine that's a whole lot less effective than 95%. So these are dramatic and very, very successful.
Wow, that's great to hear. The next question is, do we need to keep masks on even after taking the vaccine to protect us from the Delta variant or any other mutations of the COVID-19 virus?
The advice I'll give you is that of the CDC as well as our own, which is vaccinated people, as long as they're not in a high-risk situation, can go without a mask. The exception with that would be like in congregate living situations, like in nursing facilities or prisons, for example. But mostly can go without a mask. Now, I think a really important concept to share with your viewers is that one size doesn't fit all. and you have to consider risk. Am I putting myself at risk? If you go into a smoky bar in a basement where very lousy air handling, there's going to be a fairly high number of people probably that are unvaccinated, and fairly tight quarters with virus being spread. I would not go into that. I wouldn't go into that setting in the first place. I would be upstairs or outside or something else. But wear a mask when you're in close approximation with people who are or quite likely to be unvaccinated.
Yeah, that sounds great. So what is the difference between these mRNA vaccines and a normal adenovirus vaccines like Tdap or anything like that?
Yeah, this is the first time that that the mRNA vaccines has been used so widely in humans. We've used them in veterinary situations and others. So the mRNA technology is not new. And basically what it does is it turns on a certain series of processes that recognize the spike protein. So it genetically probes the immune system to recognize a certain protein on the surface called the spike protein. That's as opposed to the adenovirus, which it's kind of it carries the material and doesn't activate the messenger RNA in the same way. So the J&J product is more of a traditional adenovirus, an attenuated, meaning an adenovirus that has lost, has had its potency taken away from it. And then the contents of it stimulate the formation of an antibody also against the spike protein.
So the COVID vaccine doesn't actually give you COVID, right?
It does not give you COVID. There's no COVID in the COVID vaccine. Absolutely right. Good. And that's, I'm so glad you brought that up, because that's one of those things that that we have to keep reminding people of. You cannot catch COVID-19. Now, I don't know if we're going to get to side effects, but people will get oftentimes side effects from any of the vaccines we've talked about. And but that is, and it's oftentimes given as a reason for people not wanting to get the vaccine. And I understand that. When I received the 2-dose vaccine series, Moderna, and first one breezed through, second one got a little bit of probably 8 or 10 hours of kind of chills and achiness. I still worked. It wasn't a big deal, but we've seen people die, and the reason given for not having gotten the vaccine was because they were afraid of the side effects. That is not a good reason to avoid the vaccine. That people breeze through it. Yeah, they might feel lousy for a day or so, but it's really worth it.
Wow, that's great to hear that, because it is very true. You can't be afraid to take the vaccine just because of the side effects, because if you get COVID, you could get the side effects and it could go to the extreme case of death. So the next question is, why does COVID in general affect everyone differently? Some people have runny noses while someone needs to be hospitalized. And I think this might go in where you said one size does not fit all. So is that similar here?
Right, it is. The mechanism of action, a virus comes in the body, it activates lots of very active substances and compounds in the body. And it's everything from the brain on down to the toenails. And I mean that quite literally. We see people that have brain abnormalities and clots in their brain. So it affects the lungs, of course, in a very dramatic fashion. It has gastrointestinal effects. Even I mentioned there's even such a thing as COVID-19 toenails. Even people's nails are affected. So, and it's because there's this whole family of inflammatory compounds that the virus causes it to be released, that affect every cell in the body. But more so in everybody is varied in that, and some are much more of lungs and lungs only. Some people have fogginess of the brain and they just can't think straight. So there's a whole myriad, and just when we think we've heard it all, then something else comes in. So it's we're learning a lot about this as time goes on. We're 17 months into this or something, and we're hearing more case studies all the time that are dramatic and differ from what we think we knew.
Mm-hmm. Well, thank you for answering that. The next question is, when can a pregnant woman or a nursing mom get the vaccine? Is it safe?
Yeah, as a matter of fact, it not only is safe, but it's recommended. And the reason is pregnant women, when they get COVID-19, they have a worse outcome than non-pregnant women or non-pregnant people. So yeah, it is also and they have worse pregnancy outcomes as well. So it's really important that pregnant women have a good heart-to-heart discussion with the doctor who's providing the pregnancy care for them. And I think that everybody wants information, and I think it's really important that people ask these same questions of their caregivers. And but because of the risk to a pregnant woman and her baby, important to get the vaccine.
Yeah, that makes a lot of sense. Thank you. So one of our viewers stated that the first vaccine dose got them really sick. And so then they're refusing to get the second dose because they don't want to put themselves through that again. How would you respond to this?
Well, it's always hard to look forward to a second shot when the first one made you sick. I would encourage them to get that because it really boosts up the immunity quite dramatically. And you know what? It is not a foregone conclusion that they're going to have the same or worse side effects from the second one. We've seen it all. So I would just say that if a person has fever, to make sure they're ready to plan their schedule accordingly, have Tylenol, and baby themselves for a day or two or whatever it takes. But I think it would really be important to stick with it and to kind of suck it up, quite honestly. I know that, I don't know if you know this or not, I'm also a colonel in the United States Army. And part of me just says, look, you can't get something for nothing. And I understand, I'm sympathetic to this concern about not wanting to bring it on themselves. But in the long run, they'll be very happy that they did, just to tough it out and plan a day off from school or work or whatever, take some Tylenol and get through it.
Yeah, that makes a lot of sense. And thank you for your service too.
Sure.
So speaking of like those illnesses from getting the vaccine, can people with serious illnesses actually get the vaccine?
Not only can they get the vaccine, but they should. And the reason is those same illnesses you're talking about, whether it's solid organ transplant or immune deficiency syndromes or these cystic fibrosis or heart disease, that puts the person at greater risk. You remember early on, the kind of news media didn't handle it very well, saying, oh, it's just old people that are dying. It's just people that have underlying illness. It's not just people with underlying illness, but they are at more risk for not only getting the disease, but having worse clinical outcomes. So they should especially get the vaccine.
Yeah, well, thanks for answering that question. And also thank you for your service too. Yeah, so the next question is, do the COVID-19 vaccines contain aborted fetus cells?
No, it does not. We're certainly not in the mRNA ones. Now, the Johnson & Johnson product, like you mentioned Tdap and measles and some of these other ones, are grown in cell culture that are what are referred to as immortal cell lines that were developed, I think, I think in the 60s, primarily under that were from fetal cell origin, but there is no fetal cells in the vaccine itself, but that's where the tissue culture is in these immortal cell lines that has come from fetal tissues in the past. And for example, I'll tell you, the Catholic organizations, for the most part, and other ones have already said that from the ethical and religious directives of the Catholic Church have said it's okay to get the vaccine, that there's a series of greater goods. And again, this is not aborted fetuses from any recent time. It's immortal cell lines from back in the 60s. Legitimate question. And if you want, what we do is we try to always have all three vaccines. If a person says, I don't want that J&J because where it came from, fine, let's get you the other one.
Yeah, that definitely makes a lot of sense. So speaking of the Johnson & Johnson vaccine, there were reports that the vaccines can cause blood clotting problems. Is this true?
Well, there have been, and it's a very small handful of cases worldwide. And when you think about 320 million doses we've given in this country to have a small handful of cases, that it can happen. It's kind of a central venous thrombosis that has people worried. But it's been very few, and certainly when you evaluate the risk and benefit of it, it's in my book anyway, is well worth continuing, because people with the illness are 1 out of 5 people with the illness have intravascular clotting. So we're talking about a handful of cases out of 320 million. Do that risk benefit analysis, and man, that's very clear. 1 out of 5 have some kind of deep venous thrombosis, clotting in the vessels from the illness. And so in my book, very clear risk benefit.
Yeah, so that's definitely something our viewers should be paying attention to. You have a higher chance of getting deep vein thrombosis from the COVID-19 itself rather than the vaccine.
Right.
So, yeah. So the next question is, last year I believe this person is referring to the media and the CDC. I can't quote you on that, but it says last year they said kids age 0 to 18 don't get seriously ill or spread the illness. Then why do they need the vaccine?
They are very good at catching the illness and spreading it and having an occasional really bad outcome. This multi-system inflammatory syndrome that can really affect kids. We've had kids as young as, I think, down to 5 or 6 die in the state of Kansas. An infant as recently as November that has died of COVID-19. So kids are very effective at spreading it. We think that probably, and we have a long ways to go. The last numbers that I've seen coming out of the CDC, what's called seroprevalence studies on blood samples, and you can tell natural occurring disease from vaccine immunity, that 22% of kids under age 12 have had the illness. That means that it's almost 80% of kids have not received the vaccine and have not had the illness, so are non-immune. We have a long ways to go. And so back to your guys' earlier question about when is it going to be approved? Bring it on. You know, I wish we had it yesterday. We've had pretty good uptake in some school districts, and we've done hundreds of kids in some certain school districts that have put an emphasis on it, and we will do everything we can to support those kind of immunization programs.
Yeah, that makes a lot of sense. So the next question that one of our viewers had was saying that they're due for their second dose of COVID during their menstrual cycle. Are they still able to get the vaccine, or should they postpone it?
I think that they should go ahead and get it if it works well with their schedule. Menstrual cycles don't last forever. It's a good question. And if a person has cramping, feels lousy all the time, and they wanted to put it off a week, I don't think that would be a problem. But a person, if they're scheduled to get it and they're doing okay and don't feel too inconvenienced or uncomfortable with their menstrual cramps, I think there's no reason not to get it.
So the next question is, I didn't have any side effects from the vaccine. Does it mean that it didn't work?
No, I would not make that assumption. People breeze through it sometimes without any symptoms at all. So I wouldn't make that assumption at all. I do sometimes worry if a person has underlying immune deficiency syndromes, just because they don't fight infections well and whatnot. I worry that there could be some people that don't react, or like on cancer chemotherapy drugs. There could be people that don't have as brisk of a response because of the underlying condition, but I would not assume that the absence of side effects means that it wasn't effective. To the contrary, I would say it would be much more likely than not effective. And it would surprise me if a person received a 2 vaccine series and didn't have a little bit of symptomatology on the second one, but anything's possible. Get the vaccine.
Yeah. So once again, one size does not fit all there. You could agree.
Exactly. Yeah.
Okay. Awesome. So one of our viewers says that their whole family of 3 of the 4 family members have been completely vaccinated, but they have a youngster who's age 6, and she's asking if they should continue to wear masks to save her unvaccinated child from the virus.
No, I would not recommend that. Certainly not in their household. When the kid goes out and is in groups of people, yes. But in their own household, that child is very safe because of the forward-thinking nature of the rest of the family. Now, if any of the family members got sick, or if the child was sick, then you'd want to be tested. But in the absence of any kind of symptoms, I think they can just go be within their family unit, a normal family, without having the child have to wear a mask.
And doctor, I know this person, so I think when they say wearing masks, I think they're saying in the public setting, like an outdoor setting. You're once again probably going to go back and say in a high risk setting, continue to wear the mask. Is that right?
Yeah, you're right on that. I would,
Okay.
in an outdoor setting, it would be considered low risk. I would not worry about that. But certainly, if they were in a wedding or a funeral or a big indoor, because it's raining outdoors, and an indoor picnic with all sorts of people jammed close together, that'd be a good time to wear a mask.
Okay. Yeah. Thank you.
So the next question we have is one that was based on some rumors, but we just want to ask it to you. Does the COVID-19 vaccine actually cause infertility either in males or females?
No. That's the shortest answer I'll give today. No.
Yeah.
I don't know where that started.
Well, I can tell you, many of my friends, they were straight worried about this, and I said I could ask you today during the interview. And so, yeah, well, there you go. To whoever asked that question, there you go.
Yeah.
No.
Yep, plain old no. Now, I will say, a lot of people have infertility problems, men or women, and sometimes maybe people are making this association game where they get a vaccine or get anything, and then they have a hard time getting pregnant, for example. But because up to 10% of couples are infertile or have impaired fertility, but it is not associated with this vaccine. End of discussion on that. There's no problem like that.
So the next question is, how can I trust the vaccine if it isn't FDA approved?
Yeah, real good question. First off, I wish it were. Because it's gone through all the steps to be authorized by the FDA under emergency use, but it is true that it's not approved. I just say that it's the same data, that's the same process to go through with the CDC and the group that does the recommendations. And I think that if people haven't gotten it to this point, I would wish that it's the minute that it's approved by the FDA, it would be given. I think that they can feel quite comfortable because the emergency use authorization process is essentially identical to the approval.
Okay, thank you.
All right. So are you confident that the vaccine will not have any negative long-term side effects?
Yeah, I am confident that will be the case. Now we don't have a long-term experience with it yet. Although we've been working on these mRNA vaccines and specifically novel coronavirus for 15 years. It's, you heard about, we haven't talked about the term warp speed, Operation Warp Speed, which is where the vaccine was distributed. The research on this was not warp speed. It's been going on for a decade and a half, mostly at Oxford. The warp speed was about the production and distribution, not the research that led to it. So we are gathering information all the time as time goes on, but I don't think there seems to be what they call a signal at the CDC. There can be side effects from it, and we've talked about the risk-benefit kind of considerations, but there's nothing cropping up that's a long-term side effect.
Yeah, so the big takeaway here is that the vaccine development was not rushed.
Right. It was not rushed. The development has been very, very steady. Really ever since 2003, 2004, when SARS raged into being. But you recall that SARS kind of burnt out and went away. And so a lot of the big pharmaceutical companies said, well, we're not going to bother spending millions of dollars on development of vaccine for a disease that doesn't exist. But Oxford, AstraZeneca, and others said, well, in time of peace, prepare for war. We better be ready for this thing. And I'm very thankful that they continued with the research as they did, and I'm glad it was funded. Yeah. Because here in the little state of Kansas, we did 2 million vaccine doses in 20 weeks.
Wow.
And that's phenomenal.
That is awesome. Yeah.
200 million in our United States in 20 weeks. We usually, to put things in perspective, public health in the state of Kansas usually does right around 32,000 vaccine for children doses a year. So last year to do 32,000 normal vaccines to go to, we're at over 2.5 million COVID-19. That is warp speed. And but we have a lot of vaccine and still a lot of it unvaccinated people. So we're ready to, anybody steps up.
Yeah, sure. So the next question is, I guess it's very similar to your answer right here. So this person asked, why does everyone need to take this vaccine if the vaccine works?
Well, we have to get to a certain critical number of people to really, you've heard about herd immunity. We haven't used that term yet, but when you get to a sufficient number, and herd immunity really isn't about a sufficient number so much as the concept that it doesn't spread within a population. I would answer that also by saying, you know, if 90% of people stop at stop signs, there'll be very little harm done to the other 10% that run the stop sign, because the other 90% have stopped and are watching and looking both ways. It's a little bit the same way with herd immunity. COVID-19 it's not as infectious as measles, for example, but it's more infectious than some of the other primarily respiratory illnesses. So if I had to stick my neck out and say, what is the percentage of people that we need to get to have the herd immunity sufficient that it doesn't spread within a population, i.e. it burns out, goes away, I would guess probably between 70-75% of the population, maybe 80%. And I'd love to see us get there, because that's when we can stand down and relax and have a normal life again.
Sure, I have some follow-up questions about that. So, so obviously you would kind of agree with what Dr. Fauci said. He said he's quoted around 75 to 85% of out of America. So you're expecting about 70 to 80% of Kansans to get vaccinated for us as a state to reach herd immunity?
Yeah, I think so. I think we're pretty normal in that regard. I do worry. I worry that we could have up to 30% of people that just don't want to get vaccinated. I'm hoping that people will stay open-minded. I've learned a long time ago, you cannot browbeat somebody into making a decision they don't want to make, especially for something that's not required. And I would hope that people would see the light, in my opinion anyway, and get vaccinated. But that's about the same numbers for Kansas, yes.
Okay. And my second question is, what percentage of teenagers, the same percent, or more specifically, how many teenagers are you expecting to get the dose so that we can reach the herd immunity? Because obviously the adults make up a certain number of that threshold you're expecting, but what number of the teenagers should be taking?
You know, it's the same number, really. Yeah, it's the same percentage wise. You know, the other thing, and this is a public policy matter, will people eventually be required as part of their jobs, for example, to be vaccinated? It's not required for school, you know, attendance now. It's unlikely that anytime soon that it'll be required for school attendance. Our hospital is going to require it. Many already are. Our nursing facilities, like nursing homes, requiring of their staff, many already are. So I think it's going to become more the norm. I do worry about how political it's all gotten, and hopefully people will just settle down and look around them and say, you know what, people that are unvaccinated are getting sick, and people who are vaccinated are not getting sick. The light goes on and they get vaccinated. So hopefully that'll be the case.
Yeah, that's a really effective explanation. So next question is, how does the vaccine affect people who have already had COVID-19, either ones who still have long-term effects or those who have recovered fully?
Yeah, well, we know it boosts their immunity. It is estimated that a person after a vaccine series has 8 to 10 times the neutralizing antibodies in their body against the virus, so that it's 8 or 10 times higher levels of immunity, if you think of it that way, than the naturally occurring illness. It doesn't seem to be worsening those people that are what are referred to as kind of chronic COVID-19 or long haulers. You might hear referred to as that. People that have kind of a foggy memory, or people that have other kinds of manifestation of chronic illness following the COVID-19, they still are recommended to get the vaccine. It doesn't appear to worsen their chronic COVID-19 symptomatology.
All right, so thank you very much for that answer. The next question is, how can we convince others to take the vaccines? And specifically, obviously, some of them are scared of the false information they get from their news sources, or their political beliefs sometimes inhibit them from getting the vaccine. Or even one of our teenage viewers asked that there's multiple incentives for adults to get it, why aren't there any incentives for teens to get it? So how would you respond to that, doctor?
Yeah, let me comment on the incentives first. There are, I personally think that living is an incentive, and not having to be hospitalized or chronically ill is a pretty significant incentive. Yeah, adults, there are some lotteries and things like that. There are things for youth that are essentially lotteries for school tuition, books and fees and housing, that kind of thing. I think I'm not a huge fan of the incentives because I think that I'd rather have people step up and get vaccinated because of the fact that it's good for them and it's the right thing to do. Now, there was another part to your question.
Yeah, how can we convince others to take the vaccine?
You're doing it right now. Keep doing what you're doing. You know, because one of the things that I do know is, who do people believe? What can turn a person's mind around?
Probably their friend or colleague or something like that.
Friend, colleague, their own personal physician, somebody that's been through it themselves, case studies of people that had a very bad situation with COVID.
Mm-hmm.
This is personal. Their churches, family groups. Make it personal and communicate with people you love.
Yeah, thank you. Yeah.
So I guess the final question that we have here for you is, what will the school year look like for students?
You know, the local school boards in Kansas have a lot of the decision-making powers as to what it will look like. It kind of depends, I think, and that's going to be coming up pretty soon. As a matter of fact, we're meeting with education. We met all along with the Department of Education, have very good relationship with. I think there'll be a little variety, and particularly in K through 12, some schools are putting in testing protocols for athletics and other kinds of things. Some are will continue to wear masks. It wouldn't surprise me if this Delta variant keeps on growing. I think kids will still be in school, but I think it's more likely that there'll be testing protocols in place with the rapid point of care testing, not, you know, that so you can get the answer right away, and some mask wearing, and then of course distancing. And really important, and I haven't mentioned this, is stay home when you're sick. It amazes me whether you're an adult working in a daycare or a nursing home or something like that. It almost makes my brain hurt how many times we see where people unvaccinated, sick, and come to work, and then they infect a bunch of, you know, folks. So if you're sick, stay home and get tested. So I think it's going to be a mixed bag, and there'll be some schools that'll have significantly more testing and mask wearing, and some that will fling the doors open and say, no, come on, come all. I think it goes back to, again, we've talked about risk-based decision-making. In those counties where there's a lot of disease transmission, they should be flexible and nimble enough to adjust to do things that prevent the spread of the infection. And then, of course, everybody that can be vaccinated should be vaccinated. I'd love to see vaccine clinics at schools. And we're going to do a lot to help bolster the school nurse program and on-site testing and vaccines. So hopefully that'll protect.
Yeah. So your opinion is that should these schools who have high numbers of unvaccinated students continue the precautions such as the plexiglass dividers, hand washing, distancing, masks?
Yes.
Yeah.
Yes.
Okay.
Yeah. You know, that last year we saw almost no respiratory illness. You know, we had almost no influenza, and we had a good solid influenza vaccine uptake this year. But the thing that you just brought up, Sakesh, that it is, yes, hand washing, covering your cough and sneeze, those things really work. And we saw no influenza this year. It was amazing.
Yeah. And so one more question. This isn't on a sheet. It's just something that came up to my head right now. Do you think that the Department of Education is going to require the vaccine for the students, or should I say require these precautions for this upcoming school year?
I think it'll all come through the education department to the local school board, and it'll be ultimately the local school boards that make the decision. I think we work with education and provide guidance and hopefully resources to test and to screen and to educate. And hopefully in higher risk situations, they'll apply some of those anti-infective measures, things to prevent infections. And I think we're starting to see people have a dose of reality, because this is not out of sight and it's not out of mind. 672 new cases today, 12 new deaths recorded in the state of Kansas today. These are preventable. We had 672 preventable cases. That's since Friday, by the way. That's a 3-day total.
Yeah.
12 new deaths since Friday, 3-day new. But this is a preventable illness, and so we cannot turn a blind eye to it and say, "Oh, good, it's not as bad as it used to be, so it's fine." It's not fine. We can do better.
Sure.
Those are some very inspiring words, Dr. Norman.
Yeah.
And Sukesh, do you have any more questions?
No, I think I'm done with questions. We really do want to take some time, our viewers, please. A virtual clap for Dr. Norman.
Yeah, thank you so much for today.
Okay,
and for us as well as the viewers. Thank you so much for joining us today to inform us and the viewers about the COVID-19 vaccine. We really do appreciate it, sir.
Thank you. Well, this is a brilliant format for doing it, and there are smart questions, every one of them, whether they're from you guys or from your viewers, but I thank them. You guys keep me on my toes, and I sure appreciate that, and I'll be happy to come back anytime.
Yeah, thank you very much.
Okay.
Yeah.
So there you have it. Hopefully we answered all of your questions about the COVID-19 vaccine.
If you have any other questions, remember to go to vaccines.gov, ask your healthcare professional, or DM us at S_S Medicine Made Simple, and we'll try our best to answer your questions, and we'll link all those down below in the description box.
Once again, I'm Shaker.
And I'm Sukesh, and this is Medicine Made Simple.
If you enjoyed this video, make sure to like and subscribe.
And let us know in the comments what diseases we should cover next and who we should interview too. Until next time, live happy
and healthy.
and healthy.